My name is Caroline Lowe and I'm one of Airedale Lead Midwives for Parent Education. The aim of this tour is to show you some of the maternity services we provide here at the hospital. Most pregnant women will be seen by a community midwife and appointments will be held in either a local GP surgery, children's centre or in your own home. For some women you may need to attend the hospital during your pregnancy. We hope that after watching this tour it will have given you all the information you want about our maternity services, but if you still have any questions please ask your midwife. The entrance has a vending machine which will provide snacks, but when you are coming into the labour ward you might want to bring more nutritious food and drinks for you and your birth partners. You can telephone the hospital at any time of the day or night. We ask that you always telephone labour ward first before you make your way to the hospital so the midwife is expecting you. Welcome to our Midwifery Led Unit. Women who have had a very straightforward pregnancy, are planning limited pain relief and have decided to give birth in the hospital will have access to these rooms if they want. We have 4 midwife-led rooms at Airedale. All our midwife-led rooms have access to outside space, providing you with the opportunity to be fully mobile whilst enjoying the outside environment. The rooms have ensuite wet rooms, CD players with iPod docking stations, and you will have access to a midwife or member of staff at all times. We encourage women to be as mobile and as active as they wish during labour. We have birthing bowls, bean bags, birthing mats and Febrimeds available. 2 of our rooms have birthing pools. You can use gas and air whilst in the pool and the water provides you with the freedom to change your position easily. For women who have had no complications, you will have the option of going home from labour ward. If you are going home from labour ward, you may be asked to wait for your paperwork and notes in our lounge. Welcome to our consultant-led unit. At Airedale, midwives and doctors work closely together. We have 4 labour rooms on our consultant-led unit, each with ensuite facilities. These rooms are usually used by women who have had complex pregnancies or medical needs or who have requested an epidural for labour. All labour rooms have access to birthing bowls, gas and air, a midwife call bell system and a CD player. The beds on labour ward are special beds and let you change your position easily. Most women will experience a vaginal birth, but for those women and babies who require an emergency or planned caesarean section, we have a dedicated theatre and team on labour ward. If you are not going home from labour ward, you will be transferred to our maternity ward, Ward 21. Ward 21 is on the 2nd floor. Access from labour ward is via the stairs or lifts. Visiting times are available to view on our website. Ward 21 is a mixed ward of both antenatal women and mums and babies. The ward has 15 beds, with the majority being side room accommodation. If you are given a side room, we have the facilities for your partner to stay overnight with you if you would like. How long you stay on the ward will vary depending on individual needs. The ward has a day room with a television where meals are served. You may choose to sit in the day room with other mums or your partner, as this is an excellent way to build up support networks for you, or you may choose to take your meal back to your bedside. Security is really important, so all babies in the unit will be provided with a security tag, and it is really important that this remains on your baby's identity label at all times. Your baby will be in a cot at your bedside during your stay in hospital. Once you and your baby are assessed as fit and able to go home, your midwife will transfer your care back to your community midwife. For some women, their babies may need to go to special care. Here at Airedale, the neonatal unit is on the same floor as Ward 21, so it is easy to get to. If your baby is needed to be cared for on our neonatal unit, staff will inform you of visiting times on admission. If you are under the care of a consultant, you will be asked to attend some or possibly all your antenatal appointments here at Airedale. There is car parking facilities outside the antenatal clinic, and to access this car park you will need to turn left at the top of the hospital grounds. Every woman will be offered an ultrasound scan. Within the antenatal clinic we have 2 ultrasound scanning rooms. Our Maternity Assessment Centre is located on the ground floor, next to labour ward. Access is via Antenatal clinic entrance or from the hospital main entrance. The unit is well signposted within the hospital. You may be asked to attend Maternity Assessment Centre during your pregnancy if your midwife or doctor requests further tests. We have a large waiting area and 4 individual rooms. Maternity Assessment Centre is a service available for women who are more than 20 weeks pregnant. You can call the assessment centre for advice and can also self-refer if you have any concerns about your pregnancy. Thank you for taking time to watch this virtual tour, and we hope that you have found it useful and you will choose Airedale Hospital to provide your maternity care. Please take a look at our maternity website if you require any further information.